We've learned a lot about the health system. We could see huge opportunities to move forward with the health insurance agency being in the health portfolio, and therefore the incorporation of the broader health policy objectives more closely. By health policy objectives, what do we mean? Well, we want people to stay well. We want people to get care closest to home. We want hospitals not to be crowded. We want health workers to perform well. We want them to have an incentive to work well. So that means we really have to think about what are the different mechanisms we put in, not only to the health insurance agency, but really coordinate all the financing levers that government has so that all the health providers, whether it's hospitals or health centers, are doing the best, the most efficient work possible. And people are going to the least costly level. And the health insurance agency has a proper process for assessing what are the really expensive things that it should not fund, with what are the cost-effective things that should be included in insurance. So we see that the road to universal health coverage is before us here in Mongolia. It is possible, but there are some key things that need to be put in place. And getting the financing levers to be well coordinated with the service delivery system is the way forward. Simplistic in many countries where people think if you pay for healthcare, you have universal health coverage. Just because you pay doesn't mean that people access healthcare or use it in the right way. So I think Mongolia has very good foundations. And probably there's a few, if we think about this, the UHC road as a series of bricks that lead to the same place, there's probably a few broken bricks and a few missing bricks that just need to be patched up in a way that meets 21st century expectations. Because I think, at different stages of economic development, people expect different things. And I think the population now is well-educated, sophisticated, and they want the best they can get. So the system has to keep moving with the population. For instance, many people now prefer to go to the hospital when it would actually be cheaper and more convenient to be going to the health center. So there's a level of dissatisfaction. We need to understand that better. But the current financing for primary care doesn't really provide an incentive to improve performance. And so if that's not in place, they're not necessarily being responsive to the community. The community's response is to walk with their feet and go to the hospital. So that's just a small example of where we really want a very good primary healthcare system to keep people well, to keep people spending less money on their healthcare. I think you need to be thinking about what is it going towards and who's bearing the burden. Because it may be that that burden is being borne by some groups more than others in a way that's unfair. It may also be that people are paying for things that the system is not providing that the system should. Now, I think in Mongolia, part of the out-of-pocket payment is for medicines. So while health insurance has a certain amount of subsidy, I think it's really important to have a closer look at what is included, what's not, what should be funded, because it may be that this is an area where some improvements can be made. At the same time, it may be that not everything should be free. So you may readjust, maybe pay less for some things, but start to pay for some other things. It's a complex issue that warrants closer examination.